Have you ever noticed how your grandmother suddenly stopped enjoying her favorite foods? Or how your grandfather started complaining about that burning sensation in his stomach right after meals? If you are over 65 or have elderly loved ones who are constantly dealing with stomach pain, nausea after eating, or that uncomfortable bloating that seems to never go away, you are definitely not alone in this struggle. Gastritis in seniors is becoming increasingly common, and the reasons behind this condition are more complex than most people realize. The truth is that as we age, our digestive system undergoes significant changes that make us more vulnerable to gastric inflammation. But the good news is that understanding these causes is the first step toward finding real relief and getting back to enjoying meals without fear or discomfort. Welcome to our channel, where we focus on digestive health solutions specifically tailored for seniors and their unique challenges. If you are tired of avoiding your favorite foods or watching elderly family members suffer in silence, make sure to subscribe to our channel and hit that notification bell, because we are going to share evidence-based strategies that can make a real difference in managing gastritis symptoms. Drop a comment below letting us know what city you are watching from, and share your biggest gastritis challenge, whether it is morning stomach pain, discomfort after eating, or that constant worry about what foods are safe to consume. When we talk about gastritis in seniors, we are dealing with a condition that affects millions of people over 65 worldwide. Yet it often goes undiagnosed or mismanaged because many dismiss stomach problems as just a normal part of aging. This could not be further from the truth. Gastritis, which is the inflammation of the stomach lining, becomes more prevalent and more severe in older adults due to a combination of physiological changes, medication interactions, and lifestyle factors that accumulate over decades of life. The stomach lining, also known as the gastric mucosa, naturally becomes thinner and more fragile as we age, producing less protective mucus and stomach acid, which ironically makes it more susceptible to irritation and inflammation from various triggers. One of the primary causes of gastritis in seniors is the widespread use of non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, which include medications like ibuprofen, naproxen, and aspirin that many older adults take regularly for arthritis, joint pain, or cardiovascular protection. These medications, while beneficial for managing pain and preventing heart attacks, can significantly damage the stomach lining over time, especially when used consistently without proper stomach protection. The problem becomes even more complicated because many seniors take multiple medications simultaneously, creating a perfect storm for gastric irritation. Blood thinners, certain antibiotics, corticosteroids, and even some supplements can contribute to stomach lining damage when combined with the natural aging process of the digestive system. Another major factor contributing to gastritis in seniors is the increased prevalence of Helicobacter pylori bacterial infections, which can go undetected for years or even decades before causing serious symptoms. This spiral-shaped bacterium burrows into the protective mucus layer of the stomach, causing chronic inflammation that gradually weakens the stomach lining and makes it more vulnerable to acid damage. What makes this particularly problematic for older adults is that their immune systems are often less capable of fighting off these bacterial infections effectively, allowing H. pylori to establish a persistent presence that continuously irritates the gastric mucosa and can eventually lead to more serious complications like peptic ulcers or even stomach cancer if left untreated. The dietary patterns that many seniors develop over time can also significantly contribute to gastritis development and progression. As taste buds become less sensitive with age, many older adults begin consuming more highly seasoned, spicy, or processed foods to enhance flavor, not realizing that these dietary choices can be extremely irritating to an already vulnerable stomach lining. Additionally, irregular eating patterns, which are common among seniors who live alone or have reduced appetites, can cause the stomach to produce acid at inappropriate times, leading to self-digestion of the gastric mucosa when there is no food present to buffer the acid production. Stress and emotional factors play a crucial role in gastritis development among seniors, though this connection is often overlooked by both patients and healthcare providers. The chronic stress associated with aging, health concerns, loss of independence, financial worries, or the death of spouses and friends can significantly impact digestive function by increasing cortisol production and disrupting the normal protective mechanisms of the stomach lining. This stress-induced gastritis can create a vicious cycle where stomach pain and eating difficulties cause additional anxiety and depression, which in turn worsen the gastric inflammation and perpetuate the problem. Alcohol consumption represents another significant risk factor for gastritis in the senior population, and this issue is often more complex than it appears on the surface. Many older adults develop what experts call late-onset alcohol problems, sometimes as a way to cope with loneliness, chronic pain, or sleep difficulties, not realizing that alcohol directly irritates the stomach lining and interferes with the production of protective gastric mucus. Even moderate alcohol consumption can be problematic for seniors because their bodies process alcohol differently than younger adults, with reduced liver function and slower metabolism, leading to prolonged exposure of the stomach lining to alcohol and its toxic byproducts. The situation becomes even more dangerous when alcohol is combined with medications commonly prescribed to seniors, as this combination can dramatically increase the risk of gastric bleeding and severe inflammation. Autoimmune conditions become increasingly common with age and can significantly contribute to the development of atrophic gastritis, a specific type of gastric inflammation that is particularly prevalent among seniors. In autoimmune gastritis, the body's own immune system mistakenly attacks the cells in the stomach lining that produce acid and intrinsic factor, a protein essential for vitamin B12 absorption. This condition not only causes chronic inflammation and stomach pain, but also leads to serious nutritional deficiencies that can affect cognitive function, energy levels, and overall health. The challenge with autoimmune gastritis is that it often develops gradually over many years, with symptoms that can be easily attributed to normal aging, leading to delayed diagnosis and treatment. The role of decreased stomach acid production, known as hypochlorhydria, in senior gastritis is particularly fascinating and counterintuitive to what many people believe about stomach problems. While most people assume that too much stomach acid causes gastritis, the reality for many seniors is exactly the opposite. As we age, the cells responsible for producing stomach acid naturally decline in number and function, leading to insufficient acid production for proper digestion and bacterial control. This reduced acidity creates an environment where harmful bacteria like H. pylori can thrive, while beneficial digestive processes become impaired, leading to food staying in the stomach longer than it should and causing irritation and inflammation of the gastric lining. Nutritional deficiencies that are common among seniors can also directly contribute to gastritis development and progression. Vitamin B12 deficiency, which affects up to 40% of adults over 60, can lead to changes in the stomach lining that make it more susceptible to inflammation and damage. Iron deficiency, another common problem in older adults, can affect the production of healthy stomach cells and compromise the protective mechanisms of the gastric mucosa. Zinc deficiency, often overlooked in senior health assessments, plays a crucial role in maintaining the integrity of the stomach lining and supporting the healing process when inflammation occurs. These nutritional gaps create a cascade effect where poor nutrition leads to gastritis, which then interferes with nutrient absorption, creating a downward spiral that can be difficult to break without targeted intervention. The physical changes that occur in the digestive system as part of normal aging process also predispose seniors to gastritis in ways that are not immediately obvious. The muscular contractions of the stomach, known as gastric motility, naturally slow down with age, causing food to remain in the stomach for longer periods and increasing the likelihood of irritation and bacterial overgrowth. The blood supply to the stomach lining also decreases over time, reducing the delivery of oxygen and nutrients needed for proper healing and maintenance of the gastric mucosa. Additionally, the production of prostaglandins, which are hormone-like substances that help protect the stomach lining from acid damage, naturally declines with age, leaving seniors more vulnerable to gastric inflammation even from normal levels of stomach acid. Sleep disturbances, which affect the majority of seniors, can significantly impact gastric health through complex mechanisms that involve hormone regulation, immune function, and stress response. Poor sleep quality or insufficient sleep duration can increase cortisol levels, suppress immune function, and disrupt the normal circadian rhythms that regulate digestive processes, all of which can contribute to gastritis development and interfere with the healing process. The problem is compounded by the fact that gastritis symptoms often worsen at night, creating sleep disruption that further aggravates the condition and establishes a harmful cycle that can be challenging to break without addressing both the sleep issues and the gastric inflammation simultaneously. Environmental factors and lifestyle changes that often accompany aging can also play a significant role in gastritis development among seniors. Many older adults experience changes in their living situations, dietary habits, and daily routines that can stress the digestive system in unexpected ways. For instance, seniors who move to assisted living facilities or rely on meal delivery services may suddenly be exposed to foods that are more processed, higher in sodium, or prepared with ingredients that their sensitive stomachs cannot tolerate. The loss of control over food preparation and meal timing can lead to irregular eating patterns that disrupt normal gastric acid production and increase the risk of inflammation. Additionally, environmental stressors such as pollution, household chemicals, or even changes in water quality can contribute to gastric irritation in seniors whose systems have become more sensitive over time. The concept of medication-induced gastritis in seniors deserves special attention because it represents one of the most preventable yet overlooked causes of gastric inflammation in this population. Beyond the commonly known NSAIDs, many other medications frequently prescribed to seniors can contribute to gastritis development. Certain blood pressure medications, particularly ACE inhibitors and calcium channel blockers, can affect gastric motility and acid production in ways that predispose seniors to inflammation. Antibiotics, while necessary for treating infections, can disrupt the delicate balance of beneficial bacteria in the digestive system, leading to overgrowth of harmful microorganisms that can irritate the stomach lining. Even seemingly innocent medications like calcium supplements, when taken in large doses or without food, can cause gastric irritation and contribute to inflammation over time. The psychological impact of chronic illness and the aging process itself creates a unique form of stress that specifically affects digestive health in seniors. Unlike the acute stress that younger people might experience, seniors often deal with chronic, low-level stress related to health decline, loss of independence, and concerns about the future. This type of prolonged stress exposure leads to sustained elevation of cortisol and other stress hormones that directly interfere with the protective mechanisms of the stomach lining. Research has shown that seniors who experience depression, anxiety, or social isolation have significantly higher rates of gastritis and other digestive disorders, highlighting the crucial connection between mental health and gastric health in this population. Dehydration represents another often overlooked factor that contributes to gastritis in seniors, as older adults naturally have a decreased sensation of thirst and may intentionally limit fluid intake to avoid frequent urination or incontinence issues. Chronic mild dehydration affects the production of protective gastric mucus and can concentrate stomach acid, making the gastric lining more vulnerable to irritation and inflammation. The situation is further complicated by the fact that many seniors take diuretic medications for blood pressure or heart condition, which can exacerbate dehydration and its effects on gastric health. Additionally, the quality of fluids consumed matters significantly, as many seniors rely heavily on caffeinated beverages, artificially sweetened drinks, or alcohol, all of which can irritate the stomach lining and contribute to inflammation. The role of food sensitivities and intolerances in senior gastritis is particularly complex because these conditions often develop or worsen with age, even in people who never had digestive issues when they were younger. Lactose intolerance, for example, becomes increasingly common as we age due to the natural decline in lactase enzyme production. Yet many seniors continue consuming dairy products without realizing they are contributing to their gastric symptoms. Similarly, sensitivity to gluten, artificial additives, preservatives, and food dyes can develop over time and cause chronic low-grade inflammation in the stomach lining that may not produce obvious immediate symptoms but contributes to ongoing gastric irritation and eventual gastritis development. I want to pause here for a moment and ask you something important. Have you been struggling with stomach pain for months or even years, feeling like nobody truly understands how exhausting it is to worry about every meal and every food choice? If this sounds like your daily reality, I want you to know that you are heard and your struggle is real. Drop a comment below saying I understand my gastritis triggers and let us know what your biggest challenge has been, whether it is morning stomach pain, fear of eating certain foods, or finding meals that do not cause discomfort. Your experience could help another viewer who is going through the same struggle, and together we can build a supportive community focused on healing and hope. Hormonal changes that occur with aging, particularly the decline in growth hormone and other anabolic hormones, can significantly impact the stomach's ability to maintain and repair its protective lining. Growth hormone plays a crucial role in tissue repair and regeneration throughout the body, and its natural decline with age means that the stomach lining becomes less capable of healing from daily wear and tear or recovering from inflammatory episodes. This reduced healing capacity means that even minor irritants that might not have caused problems in younger years can now lead to persistent inflammation and gastritis in seniors. Additionally, changes in hormone levels can affect gastric motility, acid production, and the secretion of protective factors, creating a complex web of age-related changes that predispose seniors to gastric problems. The cumulative effect of lifetime exposure to various gastric irritants represents a unique aspect of gastritis in seniors that distinguishes it from gastric problems in younger populations. Over the course of 60, 70, or 80 years of life, the stomach lining has been exposed to countless potential irritants, including stress, medications, infections, environmental toxins, and dietary factors that may have caused subclinical damage that only becomes apparent as the natural protective mechanisms of aging decline. This concept helps explain why some seniors suddenly develop severe gastritis, despite not having any obvious recent triggers, as their stomach lining may have reached a tipping point where accumulated damage overwhelms the remaining protective capacity. Understanding the interconnected nature of these various causes is crucial for developing an effective approach to managing gastritis in seniors. Unlike younger adults who might be able to identify and eliminate a single trigger to resolve their gastric problems, seniors typically need to address multiple factors simultaneously to achieve meaningful relief. This might involve working with healthcare providers to review and potentially modify medications, implementing stress management techniques, addressing nutritional deficiencies, improving sleep quality, and making carefully planned dietary changes that support gastric healing rather than further irritation. The good news is that despite the complexity of gastritis in seniors, there are proven strategies that can help restore gastric health and improve quality of life significantly. The key lies in taking a comprehensive approach that addresses the underlying causes while supporting the stomach's natural healing processes. This means focusing on anti-inflammatory foods that can soothe the gastric lining, ensuring adequate hydration with gentle fluids, managing stress through relaxation techniques or counseling, and working closely with healthcare providers to optimize medication regimens and address any underlying health conditions that may be contributing to gastric inflammation. One of the most important things to understand about gastritis in seniors is that healing takes time and patience, but it is absolutely possible with the right approach. The stomach lining has remarkable regenerative capacity, even in older adults, but it needs the right conditions and sufficient time to repair itself. This means that seniors dealing with gastritis should not expect overnight results, but can be optimistic about gradual improvement over weeks and months when they consistently apply evidence-based healing strategies and work with knowledgeable healthcare providers who understand the unique challenges of gastritis in the elderly population. Prevention strategies become particularly important for seniors who have not yet developed gastritis but may be at risk due to age-related changes and multiple risk factors. This includes being proactive about medication management by discussing gastric protection strategies with doctors when starting new medications, maintaining regular eating schedules with stomach-friendly foods, staying adequately hydrated, managing stress through healthy coping mechanisms, and getting regular health screenings that can identify and address risk factors before they lead to serious gastric problems. The role of family members and caregivers in supporting seniors with gastritis cannot be overstated, as they often play crucial roles in meal planning, medication management, and emotional support that can significantly impact treatment outcomes. Educating family members about the causes and management of gastritis in seniors helps ensure that the entire support system is working together toward the common goal of gastric healing and improved quality of life for their elderly loved ones. For seniors who are currently dealing with gastritis symptoms, it is important to remember that you are not powerless in this situation, despite the complexity of factors that may be contributing to your condition. While some age-related changes cannot be reversed, many of the contributing factors we have discussed today can be modified or managed effectively with the right knowledge, support, and persistence. Working with healthcare providers who understand geriatric gastroenterology, staying informed about your condition, and being patient with the healing process while maintaining hope for improvement are all crucial elements of successful gastritis management in the senior years. The emotional and psychological aspects of dealing with gastritis as a senior should never be underestimated or dismissed as less important than the physical symptoms. The fear of eating, social isolation that can result from avoiding meals with others, and the frustration of dealing with chronic symptoms can all significantly impact mental health and overall well-being. Addressing these emotional components through counseling, support groups, or simply having open conversations with family members and healthcare providers can be just as important as treating the physical aspects of gastritis, and often leads to better overall outcomes. As we age, our relationship with food and eating naturally evolves, but gastritis should not mean giving up the pleasure and social connection that meals can provide. With proper understanding of the causes, appropriate medical care, and commitment to evidence-based management strategies, most seniors with gastritis can achieve significant improvement in their symptoms and return to enjoying food and meals as an important part of their daily life and social connections. The journey may require patience and persistence, but the destination of improved gastric health and enhanced quality of life is absolutely achievable for the vast majority of seniors dealing with this challenging but manageable condition. Remember that every senior's experience with gastritis is unique, influenced by their individual health history, current medications, lifestyle factors, and personal circumstances. What works best for one person may need to be modified for another, which is why working with knowledgeable healthcare providers and staying informed about your condition is so important. Do not be discouraged if the first treatment approach does not provide complete relief, as gastritis management in seniors often requires fine-tuning and adjustments over time to find the optimal combination of strategies for each individual. If you found this comprehensive overview of gastritis causes in seniors helpful, please remember to hit the like button, as it really helps us bring you more valuable content specifically focused on senior health challenges. Drop a comment below and let us know what your biggest gastritis challenge has been, whether it is identifying trigger foods, managing symptoms, or finding healthcare providers who truly understand gastritis in older adults. We love hearing from our community, and your experiences often help other viewers who are facing similar struggles. Of course, hit the subscribe button and turn on notifications so you never miss our latest insights on digestive health, senior wellness, and evidence-based strategies for aging gracefully and healthily. Stay informed, stay hopeful, and remember that you are not alone in this journey toward better gastric health and improved quality of life in your golden years.